James, a quick
Oh,
question.
y'all always catch me dancing. That's anyway. And that music just gets me every time. Hello, everybody, and welcome to Portsmouth Coffee Talks Evening Edition Show. I'm James Overton, and I'm here with co-host Leah Drake Stitt, and we have a special guest with us today. I think the Colonel might be on later, uh, but he is going out of town, so I'm not sure if it's today. But anyway, he might tune in later. But anyway, we have a special guest here, and Leah is going to introduce her today.
Well, I was a little worried there for a minute because Maisha just texted me. She says, "Mom, it's not on live." I said, "Oh my goodness!" I said, "Here's the Colonel now."
Yeah.
Hello, Colonel.
How you doing?
I'm fine. I'm fine. And it is on live. Excuse me. It is on live now, and it is indeed my pleasure to introduce to some and to bring into remembrance of others none other than Miss Donna Powell. Donna is the sister of my son in love. So Donna, she holds a special place in my heart as well.
I thought
And
that
Donna
name was familiar.
in this field, has been working in this HIV field for quite some time. However, she had her high school career at Woodrow Wilson High School in Washington, D.C. She studied criminology at Howard University, and she studied the natural science of HIV at the African American HIV University Black AIDS Institute. She has served as the director of a program at FAHASS
Yes.
Fahas, and she's currently the HIV HCV program manager for Baltimore Medical Systems. Donna, we wanted to say welcome, welcome, welcome to Portsmouth Coffee Talk. We're so thankful that you chose to be with us on the National AIDS Testing Day. You know,
Well,
a lot
thank
of
you
people
for
think
having
that
me.
AIDS, they think it's over because you don't hear anything about it anymore. But we need to still be aware of the fact that AIDS is still alive. And we need to be tested to make sure that we're all safe and we're keeping those who we love safe as well. So welcome, Donna. Welcome to Portsmouth Coffee Talk.
Thank you for having me, guys. I truly appreciate it.
So let's start with, first of all, how did you get involved in the AIDS program?
Whew. Back in the early 90s, I had
Come
quite a
closer
few
so I can hear
friends.
you.
Back in the early 90s, I had quite a few friends that became HIV positive while living in the DMV area. And I took an interest into what they were going through. They were ostracized. A few of them, didn't know what to do, and had pretty much given up. And so I, helped them along the way, gave them words of encouragement. And when I made my transition to the Portsmouth area back in 2000, I started volunteering with the Urban League of Hampton Roads in their outreach department. And I fell in love with it. I fell in love with the idea of trying to make a difference in my community. And so it's quite different from what I went to school for, but it is a journey that I will always love and cherish, and I will forever be my calling. I will forever be an advocate.
And how many years have you been doing this, Donna?
Ooh, 24 years in February of this year.
24 years.
24 years.
And
Definitely a passion.
with this being National AIDS Testing Day, am I correct?
National HIV Testing Day.
National HIV Testing Day.
Yeah,
Why
we
is it
don't need to
important
say
for
AIDS
people to
anymore.
be tested now when most people think that AIDS have been eradicated?
Because HIV is never going away until we find a cure. And so you need to know your status. People are still dying from HIV. They may not be dying as they once were in large numbers, but when you don't know your status, you run the risk of developing all other kind of illnesses or opportunistic infections, is what we call it, and put yourself at risk from dying with HIV. So it's here, and until they find out how to find a cure, it's going to stay, and we still need to protect ourselves. And the first way to do that is to get tested.
Let me say, you mentioned, Donald, that people don't use AIDS anymore. and sort of distinguish the HIV from the AIDS. It's a symptom of the AIDS, but it's not necessarily. HIV is not AIDS because HIV, when you diagnosed with HIV, it's more like an immune deficiency that leave you open for a lot of other things. So, sort of, explain that difference, or the people that automatically think HIV is automatically AIDS. You can have HIV, but doesn't necessarily mean that you're going to come down with AIDS.
Absolutely. When we talk about HIV, HIV is the first symptom that you develop. It's not considered AIDS until you have other illnesses that are going along with it, where your T cell drops below 200, and you have what we call other opportunistic infections that start to infect your health system, and that's when it is determined that you then have AIDS. You will forever be HIV positive, but as you said, you can have HIV and not have AIDS. AIDS is a combination of things that is going along with you because you're HIV positive.
Yeah, and that's important to know because when the epidemic was out years ago, and AIDS, the word AIDS was associated with it, it was a very scary thing, and when you
Absolutely.
heard AIDS, you really wanted to stay away from the people that had it. I remember when Magic Johnson got it, nobody wanted to play basketball with him, AIDS. So, and so now we don't want that word to be used as something that scares people away. People can live a normal life, with HIV.
Right, and you're absolutely right. We hear a lot of times people say, "Oh, that person have AIDS. No, that person is HIV positive."
Mhm.
And so people need to be able, or should be able, to distinguish the two, and that distinction comes with being HIV positive and not having any other symptoms, or being HIV positive and having other symptoms and have your CD4 count go below 200. That determines that you're now in a condition that we call AIDS, or a state of AIDS. And AIDS stands for acquired immune deficiency syndrome, which means there are some other issues going along with you being HIV positive that causes you
Mhm.
to be determined of having AIDS.
And Donna, what is the HCV?
HCV is hepatitis.
Ooh.
And hepatitis now is, at one point it wasn't treatable, but now it is. One time it was just treatable, but now it's curable. And a lot of times HIV and Hep C go hand in hand, especially from intravenous drug use.
Colonel?
Well, you know what? It's interesting that we have this subject because I remember, at the height of and being a healthcare provider at the height of the AIDS epidemic, and it was spread all year worldwide. Is that when I was in graduate school, we were down in Atlanta, down in Grady, Moonlight
Grady Hospital.
Yeah, and they actually had and which is not abnormal across this country. They had AIDS wards,
Absolutely.
HIV, and because everybody, and they actually paid you a differential to meaning more money to work on that ward. And
yeah, because they felt that you were putting yourself at risk.
Yes, and basically, you just had, just blood precautions, blood and secretion precautions. What we would treat you now come into the hospital, and so it's in. But at the time, you dressed up with your bunny suits, and you were strapped up like I was going to in a nuclear warhead or something like that.
Yeah, it was
just as they were doing with COVID.
Yes,
a few
years
back. Exactly.
But
Same concept.
COVID was different because it was airborne and aerosol, and but in the beginning we didn't know how it was spread. Well, we knew how it was spread, but the ex-president, did not disclose that to the authorities until Dr. Fauci and NIH had to discover that on their own when they knew that in the White House, but which equated to an extra 800,000 people died in America just because of what he did. So, but getting back on topic here, yes, our treatments now have progressed over the last few decades. You mentioned Magic Johnson. on how to treat and to keep people healthy with the disease. And now the problem now, and I think there is in there in trials, there's a vaccine that's coming about that's supposed to be showing some promise. Am I correct?
There is a vaccine, and it is showing some promise, but I think we're a long way from it.
Mm-hmm.
Simply because vaccines and trials take years and years to actually come to fruition. And I think they've been working on this a while, and they've had some setbacks here and there. However, there are some precautions or some prevention measures that you now can take to keep you from getting HIV.
Mm-hmm. Mm-hmm.
So, Donna, what are some of the symptoms of individuals who may be HIV positive? Or do the symptoms manifest itself once they have full-blown AIDS? Are there some symptoms when you're HIV positive, or is it not until they have full-blown AIDS that they have the symptoms?
No, you can have symptoms just being HIV. Usually it's swollen lymph nodes, either in your throat or down in your groin. Sometimes people have flu-like symptoms for long period of time. With women, reoccurring yeast infections. I'm talking about back to back to back to back is usually a symptom with some women who are HIV positive. There are some people that will develop a skin rash that will determine that they're HIV positive as well. But they're few and far in between. And there are some people that don't have any symptoms. They're asymptomatic. I have a patient now who was diagnosed in 2002, and she has been asymptomatic since then. The only way she knew she was positive because she had a child that was born HIV positive. And she's never been on any medications.
Well, I have to, I guess the National HIV Testing Day is more for awareness because it's not as prevalent. Back when it was, during the when it was really out there, but nowadays you don't hear a lot about it, and it's probably a lot of people walking around with
Absolutely.
it and don't realize it, like you say, asymptomatic, and then it's a shame that you don't find out until a child is born or something like that, or something else comes up. But other than having the National HIV Testing Day, and is that one day, what else is being done to make sure people are still aware that this HIV is still out there, and you have to be careful, as far as your lifestyle and things like that?
Hampton Roads has quite a few what we call community-based organizations, and that's their focusing on HIV. There's the Minority AIDS Support Services, who has an office in Newport News and Norfolk. There's the LGBT Life Center, who also has a location in Norfolk. LGBT Life Center. And there are a couple more that I can't really think of at the top of my head. Oh, IBWC, which has a International Black Woman Congress, which has an office in Norfolk. So there's quite a few. There are a few organizations in the Hampton Roads area that are still trying to get that message out to people, to let them know that, it's still here, and it still plagues the Black community, and they're trying to make a difference. Because Black people are the most disproportionate population when it comes to HIV.
Yeah, see, I was going to mention that because a lot of our Black communities are still full of a lot of stigmas that people don't want to know, just like some cancers people just don't want to know. But this is something different from cancer. Cancer, that's something you're going to deal with one-on-one personally. But this is something that you can spread around,
Affect a lot of individuals.
If you out there and you the man, the ladies' man, and you out there knocking them down, putting notches in your belt, and you have HIV, you're creating something that can resurface what it was back in the 80s. So
absolutely. And right now, believe it or not, women are the fastest growing population when it comes to HIV infection. It starts with men who have sex with men. And then now women are becoming infected at an alarming rate. Women are becoming infected. They have a projected lifetime of becoming infected in 1 in 250. That's a lot.
Yes.
So for every 250 people, there's a chance that at least one of 250 women, there's a chance that at least one of them is HIV positive. And
And
Black
I know.
women are
Go ahead, Liz.
leading that charge.
And we know that there's medicine that those who have AIDS, there's medicine that they can take. I've just encountered a couple of my friends who I didn't know recently who made me aware of the fact that they have AIDS, you know. But there is a medical protocol that they're on now in order to deal with the fact that they have AIDS. You want to talk about that medical protocol?
Yeah, back in it when it first came about, people were taking what we call cocktails, which was a combination of medications. Some people were taking it, as much as 20 to 30 pills a day. We have evolved to the point now that most people who are HIV positive only take one pill a day. That's it. It's almost like taking your blood pressure medication or your cholesterol medication, just one pill a day. And it's so amazing that it reduces the amount of virus in your body to the point where you're undetectable. And what we like to say, if you're undetectable, you're untransmittable. So our job is for those that are HIV positive to get them on meds as soon as possible so that they can become undetectable, and therefore they won't be able to transmit it to anyone else. U equals U is what we call it.
Okay, that was my question.
Yeah.
If they have tested positive, can they continue to infect? But as you said, if they take the medication, then they can get to that point where, but they still should practice precautions anyway.
Oh, absolutely. We always encourage people to, practice precautionary measures. But the good thing is, if by chance they have a slip up and they've been on their medication and they're taking it regularly and they reach that undetectable status, then we now know that they can't transmit the HIV to anybody else.
And how long does that usually take?
I have a patient now who reached undetectable status in 30 days.
In 30 days?
Yes.
Okay.
Well,
so we've made some strides.
Huh?
I also can imagine that getting that diagnosis that you're HIV positive can be kind of devastating. So then you're talking about the mental health aspect coming into it, where people might have to deal with that, mentally. Is it any kind of cooperation with the people that deal with the HIV and the mental health community?
Unfortunately, I lead the charge at Baltimore Medical Systems with, after the doctor gives a diagnosis, helping the patients to deal with that diagnosis. And one of the first things that me and my team do is we recommend mental health services, because it is a life-changing illness. I had the misfortune of, the misfortune of diagnosing a young man about 3 weeks ago who was 26 years old. But not only did he have HIV, but he also had syphilis.
Oh, no.
And so he sat there in total disbelief. He already had mental health issues. He was already dealing with anxiety and depression, manic depression as well. And so to be able to get that diagnosis was traumatic. And so the first thing I explained to him is, you don't have to deal with this alone. And two, we need to get you into some mental health therapy, because that's what's going to help to carry you. And you no longer have to die just because you're HIV positive. But trying to get them to understand that is quite a feat.
Mm.
I heard something long time ago, and you always heard outside of the medical community all these different things about HIV or AIDS. It was called AIDS then. Most people didn't say HIV; they just went straight to AIDS.
Right.
And that it took 5 to 10 years before they could even detect it. And I think that probably was a myth. I guess you'll agree with that. But people were thinking, I won't know until But that was out then. That
and there are people that still have that mentality.
It would be dormant it'd be in your body all that time. So, but actually, how long can it be in there undetected with no symptoms before? I guess if you don't, it could be there as long as, is it a period where it can be in there so long and nothing ever happened, or you never, but you still can be spreading it?
If you're HIV positive, with the new technology that we have, we'll usually be able to tell in anywhere from 2 weeks, 2 to 12 weeks.
Not 10 years.
Not 10 years. Now it may take 10 years for you to start showing any symptoms, 2 to
Mhm.
10 years. But if you get tested, we usually can detect it within the first 2 to 12 weeks
Mhm.
of
Okay, now
infection.
if someone is tested and the test comes back that they're HIV positive, what's the next step for them?
Getting on medication within the first 72 hours.
Putting them on medication?
And we're usually able to get people on medication that same day. So it doesn't have time to develop into AIDS.
Uh-huh.
But getting them on that medication. So the sooner you get them on that medication, the sooner that they can be on the road to undetectable.
And so,
Well,
wait, James.
no, I just wanted to ask Colonel a question.
Yeah.
How did the military deal with people that might have been diagnosed with AIDS? Was it something that would release you from the military, or how did they deal with that? I mean, you were in there long enough to see the
Yeah.
progression, how it was in the beginning and how it is before you got out.
In the beginning, we used to release them from active duty, and then after that, then we kept you on active duty, but we no longer made you deployable. Which basically, if non-deployable, you're basically, if you're for all purposes and intent, your career was over because you're not going to go but so far if you're not deployable, because there's only so many places you could go as far as being transferred to, and so many jobs that you could get, and nobody really wanted you in their command because there were so many things that you had to do, and you had to be able to be supported by a medical center somewhere, and so you couldn't be at one of these smaller posts, and then so basically you were basically done. So you just got out on it, for this disability. And most people were happy to get out on it as far as the disability goes, just leave the service. And
So it would
yeah,
also now keep you from going in if you try to go
right.
in and they detected that you were HIV positive. That would stop you,
Yeah, because it is a burden on the healthcare
even
system.
though it is treatable.
It's a real big burden on the healthcare system, when
Mhm.
especially if you're deployed, and in a wartime setting, and I get blown up or somebody gets blown up, the HIV positive, you got blood everywhere. And so that is a problem when you look at, needle sticks and other things, even though getting a needle stick and, you put them on antivirals, but then you look at some of the other associated diseases that you talk about, Hep C and so on and so forth. It's just too much a risk for you to be deployable. That's why you make them those folks are non-deployable. And so those commanders and sergeant majors don't want you in the unit because, one, we're already, no matter what they say, they may have just gotten back from a deployment. They're trying to go back again to make a name for themselves.
Okay, thanks, Colonel. And Donna, I just wanted to bring that up because as far as when it comes down to awareness and people that are thinking about military careers, that's another reason to really be careful and think about what you're doing out there in your relationships and just being aware of everything that you do, especially if you looking for in the future for a military career, because it could stop that before it got started.
Absolutely. And, with Norfolk and Portsmouth being a big military area, Portsmouth is number 4 in the state of Virginia for HIV infection, followed by Norfolk, number 5.
Yeah, that's amazing. You say that, and all the categories when you talk about it's amazing for Portsmouth. All the categories,
Exactly.
cancer, heart disease, and everything. We are leading, and then especially when you're talking about the African Americans in Portsmouth and the state of Virginia. We
Exactly.
are
And because
1, 2,
Portsmouth is
3, and 4.
right.
And
And
you
because
you
Portsmouth is
just
so
added 4. I didn't
centralized,
know 4.
yes, because Portsmouth has a large, African American population, then it is, it's something to think about. And that's why the awareness is so important, because a lot of times I've often heard people say, well, being HIV positive is the new negative. Yeah, no, that's not true. And I need y'all to stop saying that. HIV is HIV. It's not HIV negative. HIV is HIV and it's different.
Mhm.
But people don't talk about it as much as they used to because of the medications that are helping people to live longer and stay healthier. But it's still here. And we need to remember that, and we need to get tested. We need to have these awareness events. We need to have these conversations, especially with our Black community, to let them know that the only way that you're going to make sure that you don't get HIV is, one, is that you're protecting yourself, and two, is that you're getting tested, knowing your status.
Mhm.
Right.
Because you can't do anything about it if you don't know what's going on with you.
Yeah. So if you know you out there, and you out there and you doing the dues, you better get tested, and the sooner you
Exactly.
find out, the better. Because and for people that unfortunately get not knowingly get together with someone that has it and then they have it. Well, number one, it's not a death sentence like it used to be, and number
Mhm.
two, it doesn't end your relationships with other people sexually. You
Right.
just have to be careful.
Right. It's a life altering illness, but you don't have to die from it anymore.
Right.
And I would be lying to people if I say it's not going to change your life, because it's going to change your life, if no other factor than mentally and emotionally,
Mm-hmm.
and in relationships that you deal with. It's life changing, but it doesn't have to be if you, one, protect yourself, and two, get tested on a regular basis and know what's going on with you.
How often do you state that they need to be tested?
That's a sticky point. CDC says anyone from 13 to 64 should get tested at least once in their lifetime. However, I tell people that if you know you have risk behaviors like unprotected sex or multiple partners, then you need to be getting tested at least every 6 months. At least.
Every 6 weeks?
6 months.
Oh, 6 months.
Yes, every 6 months.
And that does not exclude you seniors either. Seniors,
It absolutely does
seniors,
not.
it does not exclude you at all. So you
Yeah,
need to make sure
even
that
if you're in the
tested as
nursing home.
well.
Listen, there is a very big 50+ population for those folks that are HIV positive. And I'm talking still some that are newly diagnosed.
Actually, I think that's one of the fastest rising segments of the population is our seniors, especially in the assisted living.
Oh, absolutely.
Yeah.
While working with the Urban League, that was one of my areas, senior homes, senior citizen homes, and retirement places, because I also dealt with syphilis, and syphilis and HIV go hand in hand. And it was amazing to me when I first started this work, the number of older people, the elderly people that were newly diagnosed with syphilis and had syphilis for years. And I would do presentations at these places, and a lot of them would say, "Oh, well, I'm not having sex, I'm not doing this and I'm not doing that." But by the time I got finished with that presentation, baby, leave me some condoms. Leave me some condoms right here. Them flavored ones that you talk about. Yeah, leave me some of them too.
Flavor.
Yeah, it doesn't discriminate. It does not discriminate.
Doesn't discriminate.
Does not discriminate.
I have a question as far as education. How soon, if any, can you go into the schools to educate? What's the earliest grades you can go to in the schools and start educating, if you can? You might not even be able to go in the schools. The way they stop and everything.
It's very hard to get into school. I'm not even gonna lie to you. It's very hard.
Even high schools, even high schools,
because
in the system.
it's a lot of politics.
Mm-hmm.
Especially when it comes to the PTA boards and things of that nature. A lot of parents still don't want you talking to your kids about sex or anything that relates to sex.
Yes.
I was blessed enough when I worked at FAHAS, which stands for the Fredericksburg Area Health and Support Services. We had 3 high schools and middle schools that openly wanted us to come and talk to their students every other quarter.
Can't do it.
About HIV and other STIs. they wanted the parents wanted their children to be educated, because a lot of times that's not something that parents want to talk about. So they'll leave it to somebody else to talk about. And then there are some parents that just don't want you to tell their students anything that relates to sex.
Yeah.
And that's a misfortune.
It is.
Because then little Tommy finds out from his big brother, or Sally finds out from her big sister, and a lot of times they're misinformed.
Oh yeah, I can tell you about all the information I got at a real young age from my neighbors. Everything was wrong.
Absolutely, and it hasn't
Everything was
changed.
wrong. But it
It
was
has
just
not changed.
it was just exciting listening to it. Oh, is that right? But but if they had to come into the schools, we probably would have got the right information. I mean, because and even nowadays, you could think back a long time ago, some of us might have been really naive, but these kids now, with all what they have, what they see, you would want somebody to come in the schools because they're watching all this stuff. You would want them to come in the schools. So it's a political thing. So I guess we have to, like we always say, elections have consequences. It's who's where, even locally. So
It goes back to them talking about abstinence. I think it was Bush that all he wanted to push to young adults was abstinence. Well, we found out
that's not practical.
That didn't work.
That's not practical.
That didn't work at all.
Well, that goes go back to Reagan and Nancy Reagan. Yeah, and so you can go back from then, and it was unrealistic of what they were talking about, and that's why it didn't do anything to help stop the spread. And it's going to get worse now that they've looking at trying to get rid of all birth control, and they'll get around to saying, the regular birth control as far as the pills and everything, but they will go down, and you could say the religious right even want to get away from being able to, for your kids or anybody to have rubbers, because it is a form of birth control. And so that is coming down the pipe, but people just don't know. They want to get rid of, if you look at the court case, the Oberfield case that talked about birth control, and that was just a regular pill. But those barrier type birth controls, IUDs, rubbers, and other forms, and the foams and all that, all those are a form of birth control. They want to get rid of everything. So what are you going to do then when it's time to stop the next HIV epidemic?
Right.
Spread.
And that's something they don't want to talk about.
They don't want to talk about that.
They don't want to talk about that. That's taboo.
Yes.
That's why we have to keep talking about it.
Yes.
And other programs like this, and I hope other programs like this invite you to be a guest so you can talk about it, and people that are like you in that field. I have a question. I'm just curious about this. You in Baltimore, and Baltimore is a city that's predominantly Black. Am I correct?
Absolutely.
So and you mentioned earlier Portsmouth, because we have the predominantly Black population, and we have we're high on the list of all these health things that are going on. Where does Baltimore sit as far as HIV?
Baltimore is number 1 in the state of Maryland.
Oh, they're the number 1.
We are number 1 in the state of Maryland.
So we
are number one for HIV and a whole lot of STIs.
So it's our communities that are really suffering.
It appears to be.
Absolutely. It's the Black community.
And Donna, is it primarily because our people fail to be tested? They refuse to be tested.
But not only that, there's a lot of medical mistrust in the Black community.
Mm-hmm.
So there's a lot of things we don't want to do in the Black community when it comes to dealing with medical, because of the mistrust, dating back all the way to the Tuskegee Institute. And then, for Maryland, Henrietta Lacks.
But you know what?
There's a lot of medical mistrust. Then we don't want to go to the doctor.
Well, you know what?
We'll take a remedy from Big Mama before we go to the doctor.
Yeah. Uh-huh. Well, you mentioned Tuskegee, but half of the population, especially our population, couldn't tell you anything about Tuskegee experiments. They have no clue. It's just a normal thing about distrust against the man and
the system. The system. Absolutely.
Yes.
And it's almost understandable because it's turning really into a system. In our communities coming up, you had this one doctor you would go to that the whole family went to, and you could trust him, or he would come to your house. And now it's a whole system. I mean, how many one office doctors do you see these days? I mean, it's you go into a whole business operation. You go in, you think you have a primary, and you see somebody different every time you go there, unless you request, I want to see one person. That's what happened to me. Every time I was going to this Portsmouth office, and I was seeing somebody different every time, having to, explain myself. So I made the request, can I see this one person? And they don't tell you, but if I hadn't done that, I would still be seeing different people. And I go to this office because it's convenient over here. It's not too far from here in near Maryville. But everything else I do is in Norfolk. But I wanted my primary to be here. So yeah, you're right. The mistrust and I don't know, what do we need to do uh, to sort of get people to trust more in the medical fields. I don't know.
Yeah,
Because
that's a good question.
it's hurting our communities.
It is. Baltimore medical system is the largest FQHC in the state of Maryland, and FQHC stands for a federally qualified health center. We have 8 locations and 6 school-based health, and we have that same issue. People tell us all the time because it's the FQHC. A lot of times you may not see the same doctor all the time. Unless you requested, this is who I want as my primary doctor. So we have a lot of work to do, especially in our medical field. There's a lot of work that still needs to be done. And where do we start? Education, education, education.
Mm-hmm.
Yes.
And you have to go where the need is.
Exactly.
It's good to have fairs. But you have a fair, and I'm not putting it down. You have a fair at a big hotel, and that's fine. A lot of people come, but you need to have those fairs right in the neighborhood.
Exactly.
And have all these people set up their tables right in the neighborhood, because that's where you're going to reach the most people that need your services. Not everybody's going to come down to the Renaissance. As well-meaning as and as effective it might be, you get a few people. But if you want to get the real, the people that's having the real problems, you got to go in those neighborhoods.
What I loved about Portsmouth and their Portsmouth City, Portsmouth Recreation Center, they used to have what they call Echoes of Joy every year, where they would bring
I remember that.
different agencies out to meet the needs, especially of those that are disenfranchised and homeless. And that was one of the places where I went every year to do HIV testing and to do education.
Neighborhood facilities.
Mm-hmm. But Donna, what does the testing entail? Let them know what they have to do when they're being tested. What is involved in the testing?
It's easy as a finger prick.
Just like you would do for diabetes.
You're not just like diabetes, and you'll have your results in 20 minutes.
And let's just emphasize for those who are just coming on to Portsmouth Coffee Talk. Today we have Miss Donna Powell with us, who is the HCV program manager for Baltimore Medical System. Today is National HIV Testing Day, June 27th. And we're here to encourage each of you out there to know your status. Because knowing your HIV status helps you make decisions to prevent getting or transmitting HIV. So today we're talking about HIV and AIDS with none other than an expert in this field, Ms. Donna Powell. I just want to say that for those who are just coming online.
And if people don't want it, they don't know where to get tested. We now have at-home test kits where you can order them online for free. and they will mail the test kits to your home with directions on how to use them.
What they're doing for coronavirus.
Exactly, the same thing.
You
And
know?
we've been doing it for quite a while.
But and I just have a commercial piece there. When you talk about what they're doing for coronavirus, they are doing mailing those testing kits against a brick wall of the Republicans. The Republicans don't want to mail anything out as far as testing for the coronavirus or any kind of healthcare piece. But they'd rather for you to die, because if you have a chance of voting for a Democrat, they don't care about that. So
say it again, Colonel. Say it again.
Yeah. Say it. Yep. Say it. They don't care. If you're going to vote Democrat, they could care less. They'd rather for you to die and be gone with you.
They're not like us.
Yeah. Yeah.
But let me just share what some of our
They're
viewers
not
are
like
saying.
us. You're absolutely
They're not
right.
like us.
Letitia Sysems is watching. Keith Brown says, this is heavy. Yes, Keith, it is heavy. But it's something that we need to discuss and make sure that those individuals get out there and are tested. Terry Butler says, great jewels as always. Thank you all. Lecky Boo is watching. Terry Butler, thank you for all that you do. And we just thank them for coming on and watching as well. So Donna, continue with, tell us something we don't know.
I want to speak to our Black population because we are becoming infected at an alarming rate. As of 2021, the state of Virginia had over 24,000 people positive, HIV positive. And like I stated, Portsmouth ranked number 4 and Norfolk ranked number 5. And there's 23% of those that are living with HIV are women. And unfortunately, of that 23%, 54% is African-American women. And no one is talking about that. We hear a lot of conversation about men who have sex with men, but no one is really talking about the Black woman or women in general. And we as women, and I'm talking to the women, we need to know our status. We need to protect ourselves. A lot of times we don't want to get medical treatment or don't want to do what we need to do to take care of ourselves because we wear so many different hats. We'll take care of everybody else before we take care of ourselves. And we can't take care of anyone unless we take care of ourselves first. Know your status. Take care of you. HIV is no longer a death sentence. You can live a long, healthy life with HIV. However, you need to know what's going on with you. So I encourage all the women, as well as Black people in general, get tested. Know what's going on with you. Knowledge is power. There was a slogan that came out years ago that said, take the test and take control. And I think that's very fitting. Take the test and you can take control of your life.
Oh, that's good. And people have to realize as well, I think a lot of people spend so long and you don't always hear about it. Some people might think it's gone away. It's just not that important anymore, that you can live with it. But I'm sure that there's still people that are dying from it, but maybe not at the alarming rate it was in the beginning. I mean, and we all knew people in our lives, of friendship, or even in our families, that early on when the epidemic was really out there, that were taken out quite quickly, because by the time they found out, it had developed it into full-blown AIDS. So they didn't even get past the HIV stage. By the time they tested, it was full-blown AIDS. So that definitely was a death sentence there. So people need to realize it's still here. And I think in the beginning too, they always everybody thought only people like Magic Johnson could afford the medication. That might have been the case early on, because when something like that is early, all the medications is really high, and only he could afford it. And I saw a picture of some other people that had it, like Rock Hudson and all these people, and he was in that picture. He was the only one that survived it, because he was able to, I guess a lot of that stuff was experimental then when he was doing.
That's what I was gonna say. He wasn't afraid to be a part of the trials.
Right.
He wasn't afraid to be a part of the medical trials with Dr. Ho. And so he was one of the first people that came out he started using the medication that Dr. Ho was doing experiments on, and it worked. I tell people all the time, Magic Johnson is on the same type of medication that you're on. The difference with Magic Johnson is that, one, he has a regulated diet, and that helps with people who are HIV positive.
Yeah.
You have to watch your diet. You have to watch.
Because he looks as healthy as
Exactly.
anybody.
And because he has a personal chef, or Cookie is very good at cooking, I don't know. But a lot of times in the Black communities, we eat a lot of processed foods. We eat a lot of canned goods with a high in sodium. So not only does it have an effect on our HIV, but it has an effect on our overall health. So then we have other issues that we're trying to combat at the same time. You know, it's all about taking your medications, watching your diet, and exercising. You can live a long, healthy life. You stand a better chance dying of old age than of dying because you're HIV positive.
Yeah.
Yes.
And I also want to point out that 1 in 22 Black men are becoming HIV infected. That's crazy to me.
One in 22.
1 in 22.
So that's present stats, right?
Wow.
Yes, present stats.
Yeah, so that's the point I was making. Most people think it's gone away because they don't hear a lot about it. But
and unfortunately, in the DMV area, it's 1 in 4 Black men. So we have some work to do, and it starts with education and awareness.
But I'm sure people know now. In the beginning, everybody thought it was a gay disease. Something that was only in that community.
And you still hear people saying that, James. When I mentioned that Donna was going to come on to talk about HIV, that's just for gay folks. No, it's not.
Absolutely.
No, it's not. And if you look at the commercials daily, they got commercials daily showing you the population that is impacted by HIV. So you can't say that it's only a gay disease.
But one of the things that we're constantly having conversation with the pharmaceutical companies is about the fact that the prevention medication, we have what we call now PrEP, which is pre-exposure prophylaxis. You can either take a pill or get an injection. A pill you take every day, the injection you get every 2 months. But a lot of times you don't see people that look like us in these commercials. And you see a lot of gay men in the commercials, but you don't see us. And we're becoming infected at alarming rates. So where are the commercials? Where is the education for us, to us, when it comes to PrEP?
Yeah.
Now,
and that's my biggest conversation.
How does, you mentioned earlier that some people don't know until they have a child that they have HIV, and then the child comes out with HIV. How does that affect a little baby? Does the baby have the same chance as a grown-up of surviving having HIV than someone else, so vulnerable at that stage?
One of the blessings with children that are born positive, when they're born, they have their mother's immune system. If they're put on medications immediately, their body is able to push the virus out of their body and do what we call seroconvert. Because after about 18 months, it starts to build up their own immune system. And what we've noticed is that there are kids that are born positive that will seroconvert because they're on medications from birth, and then they become HIV negative. So it's about catching it as early as possible. See, and we didn't know that back then.
Right. So what was happening?
They were born positive. It was just, oh well, another child with HIV.
Oh well, yeah.
That's not the case anymore.
And were they surviving and
absolutely,
growing into adulthood with HIV?
Yes. They like to be called now dandelions. I don't know how they came up with that name, but for those that were born positive and they're now in their 20s and 30s, they're living and they're thriving with HIV.
Wow, that's amazing. I'm just as intrigued as I was years ago when the epidemic started, and how it was, and it's been going on this long. So hopefully the information that's getting out now will capture the interest of whoever's watching, and they'll spread it, share this information with other people, because like we were talking about, it's still out there, and it's still something that's high on the medical field. You know, she's a program manager of it, so it's a position in it. So if it's a position in it, then you know it's still out there and it's still prevalent.
It's still a need for education and testing.
Still a need for education.
If
Yes,
the,
indeed.
if the government is still providing grant monies for this and the millions and millions of dollars, that means there's still a need. My prayer is that one day that a vaccine is developed and that I work myself out of a job. But for the meantime, you know, this is where we are and this is what we need to do.
Okay, well, coming to the hour, and we want to thank you so much for this very educational presentation you gave us today, and gave us a chance also to interact with you and ask questions that hopefully other people out there watching had some of the same questions and they were answered here today. The main thing is that people that become aware and make sure you just, well, one thing, take advantage of the National HIV Testing Day, which is the day, is that one day, but that doesn't mean you can still go out there and get tested. If you know your lifestyle, so
exactly,
you know what you need to do.
Take care of yourself. And I
Take
thank
care
you
of
all for
yourself.
having
And
me.
so
This has been a
if you're
pleasure.
active, you should get tested. How often again?
At least every 6 months.
Every
And
6 months.
And
Every
if you
6
don't,
months.
and if you don't know where to go get tested, you can order tests online. It's together.takemehome.org.
Together.takemehome.org.
Takemehome.org. They will mail you a free HIV test kit.
Okay, so you can get that test and do it in the privacy of your own home. But the main thing is that you get tested. Today is National HIV Testing Day in the US of A. So get your test, find out what your status is so that you can take care of yourself as well as taking care of others who you are entertaining in your life. So Donna,
I like that,
I want to say thank you so very much. This has been noteworthy because really people just don't think about HIV anymore. And it's something that needs to be brought to their attention more regularly, more than once a year. And hopefully individuals will take heed and they will go and get that test and make sure that they're protecting themselves and their loved ones. So I want to thank you so very much, Donna, from the program manager for Baltimore Medical Systems, HIV HCV program manager. I want to thank you so very much for coming on Portsmouth Coffee Talk. And for those of you who may have missed the beginning of the show, you can go to our YouTube channel, Portsmouth Coffee Talk, and you can watch it over and over again, take notes and see those things that you need to take notice of. And also like and subscribe our page. We encourage you to do that as well. So once again, Donna,
and share the information.
Yes.
Please share the information.
Any last words, Colonel?
Information. This is Maisha's letting me. She's on now watching as well. Okay.
Hey, Maisha.
Yes, thank you for sharing this information. But I hearken to the time of today. Can you imagine if the AIDS or HIV epidemic had just started now?
Ooh.
And we have this group of Confederate GOP Republicans in office now. How they would just let this run rapid, because they would think first it's a gay disease. Then they would say it's only affecting people of color. They would be so quiet and wouldn't put a dime towards it because they thought it was going to wipe out our population.
Mm-hmm.
And they thought that in the beginning until it crossed over and started affecting or infecting angel white folks.
Anglo-Saxons.
Angel, yes. They thought it was just a black thing and a homosexual thing until it crossed over to their side, their population. They were silent, and then they couldn't let it go any further. But just think if it happened today with these folks. So when you go to the polls in November, think about it. The next pandemic, the next epidemic, the next COVID piece that come there. If you want another 800,000 people die because you have a president that says, I want to keep my numbers down, meaning Mr. Trump, quote unquote, says, I want to keep my numbers down, and they're all out. They only got 13 people that we know that's in this country that's got COVID. And we don't know how it's being transmitted. When he was told how it was being transmitted, but he kept it from the American people. So if you are one of the families that have suffered a loss and you've buried one of the 800,000 people, think about who you're voting for. Are you going to vote for the man that helped murder your family member? So I rest my case, and I put it as bluntly as I could put it.
Okay, and all I have to say is if you're out there, and taking it back to HIV, if you're out there and you out there, you don't care about yourself, but you out there, you're having sex, it's possible that you could bring someone else into this world. You could pass that on to a little baby girl, a little baby boy. So think about that if you're not thinking about yourself. Who wants to come into this world with something like that that's caused by you? All right. Take care, everybody. We'll see you next time. And
Thank you,
don't
Donna.
forget to continue to watch Portsmouth Coffee Talk. Take care.
Thank you, guys.
Thank you,
Have a
Donna,
wonderful
for
Great
your
job.
information.
All right.
Good night.